Hello everyone, welcome back to another video. Today is Saturday the 7th of March and I'm coming to you from Beijing, China. And I'm here to talk about the coronavirus once again. First up with the latest numbers as of editing this video. Right, onto the numbers. As of today, there are 105,518 total cases worldwide, with 3,562 deaths officially reported. Today, Italy is in with 1,247 new cases, followed by Iran with 1,076, South Korea 448 new cases, and Germany with 125 new cases. China reporting just 100 new cases today. And then the rest of Europe. Let me just count how many European countries are in the top 10 right now. So in terms of total cases, there are 5 European countries in the top 10. And in terms of new cases today, there are 7 European countries in the top 10. And if we went to 11, the UK would be number 11. So it is all kicking off. Italy today had 36 new deaths, followed closely by Iran with 28 new deaths. The coronavirus has now affected 99 countries and territories, and it's still not a pandemic. And now onto the news. The media seems to be putting out contradictory messages to the CDC in America. The guidelines in America on the CDC website suggest that wearing a face mask actually does reduce the risk of contracting the coronavirus by quite a lot. But yet all these doctors and TV doctors and whatever that keep going on the news saying, oh no, don't buy face masks, there's no point, you don't need them unless you are sick. Yeah, okay. So folks, if you can get a face mask, do get a face mask or a bunch of face masks because they definitely do help. And I know that it looks ridiculous in some countries right now where the coronavirus hasn't yet set in, but just think about 2 or 3 weeks ago in Italy, if you walked around with a face mask, everyone would have been laughing at you. But if you continued to wear the face mask, who would be laughing now, right? Next one, onto a story from Australia. Well, it's kind of from Australia. Anyway, there's a doctor. He became unwell on a flight from Denver to San Francisco in the USA, and that was on the 27th of February. He started to have a runny nose and whatever, and then he flew from San Francisco to Melbourne on the 29th of February. So this is during the coronavirus crisis. He gets unwell while he's on a plane with a runny nose and, you know, and then he flies to Australia and he continues to work. He doesn't think like, oh, I'm a doctor and I've got some symptoms of something after traveling while there's a coronavirus outbreak. Maybe I should get checked, or maybe I should check myself, diagnose myself. No, he just continues working for a week. Let's see. Yeah, continues working for a week between the 2nd of March and the 6th of March, and he sees over 70 patients. And after this time, he tested positive for the coronavirus. So they talk about the R0 for this coronavirus. Well, I don't know what kind of a doctor's surgery he's in, but like the ones that I go to, you're pretty close to the doctor and you're in a relatively small room and you're talking like personal contact with the doctor, like right in front of the doctor. And if he tested positive for the coronavirus, then pretty much he would have given it to 70 people. And then those 70 people will have gone home and given it to their families, would have gone to work and given it to their colleagues, and would have gone to the gym and to whatever they do. And that's just how easy this thing can spread. One person can give it to so many people because people aren't taking this seriously. People aren't getting tested when they should. If, like right now, if you travel anywhere and then you come back and you have any kind of symptoms like a cold, runny nose, chest pain, aches, fever, anything like that during an outbreak of coronavirus, this is something that you should go to the doctor and get checked for. And if you are a doctor, test yourself. In some countries, you go to jail for stuff like this. You're meant to self-quarantine if you've been traveling and you come back. I know that they've got a list of countries, but that list is absolutely useless because if you look at how many countries now have been affected by the virus, you'll start to understand that making a list of specific ones like South Korea, Italy or China, like these 3, or Iran, it's in a lot of the countries around the world. All of the countries that are pretty much having these busy flights, it's in all of them. So your list is useless. Everyone with these symptoms after traveling needs to get tested. And I know the death rate is between 3 to 4%. It's not exactly a guarantee that people are going to die and start dropping on the streets, but still, you're passing on something that you don't need to pass on. And who knows how many people these people might go on to infect. One person saw 70 patients. That doesn't include the people he saw on his way to and from work, on the plane. Maybe the doctor went to the supermarket, infected a bunch of people there. It doesn't include all those people, so one person can actually infect quite a lot of people if you think about it that way. So the Grand Princess cruise ship off the coast of San Francisco is another diamond princess in the making. So far, 21 people have been confirmed to have coronavirus, and they still haven't finished testing everyone. And the funny thing is, President Trump has said this.
They would like to have the people come off. I'd rather have the people stay, but I'd go with them. I told them to make the final decision. I would rather, because I like the numbers being where they are, I don't need to have the numbers double because of one ship. That wasn't our fault.
He would prefer the people to stay on the cruise ship. Did he not see what was happening in Japan? If they stay on that cruise ship, everyone is going to get infected. They need to get the people off the cruise ship as soon as possible. He's so worried about the numbers. Why are people so worried about the numbers? Just get people. They shouldn't be worried about the number of infections. They should be worried about the number of people who can recover from the virus. So get them off the cruise ship and try and get them into care as soon as possible. I know there's no cure, but you can, I don't know what they're doing, but there are ways to help this thing along to boost your immune system. I don't know. Vitamin C injections, I'm not sure what they're doing, but I know that staying on that cruise ship is like a death sentence to half of the people on there. Get them off that cruise ship as soon as possible. What? And there's another cruise ship in the Nile? I'm telling you, this cruise ship industry, first, why are people still taking cruises? And second, all the cruise ships in the world right now should just stop, get the people off the cruise ships, get everyone tested, and get everyone sent to hospitals now, because all these cruise ships are just waiting. It's just waiting to happen. The longer they stay on the cruise ship, the more people that are infected. Just get them off the cruise ships right now. Worldwide ban on cruise ships for like at least until this coronavirus thing is under control. I'm telling you, the WHO after this should lose all of its funding. It still isn't calling this a pandemic, still recommending that people can travel. I think, the more it spreads and the more it's linked to travel, I'm seeing all around the world, like one person going on a plane and then all these people dispersing and spreading it all around the world. It's this travel that's making it spread more. Everyone that's getting it is coming off a plane or a boat. Why is everyone just so chilled about this? Everyone's healthcare system is so great that they want these people to keep getting infected for the sake of propping up the travel industry? I don't get it. Interesting piece of news, the UK is the least worried country in the world about the coronavirus. Now that is quite funny, because it just backs up everything I've been saying over the last few days and weeks about when I speak to friends and family back home and no one seems to be really worried or taking it seriously. Everyone's like, yeah, I heard about it in the news, but like no one's really serious about it. And I can completely understand, because it's been a long time since something like this has come around, and usually it doesn't make it to Europe or the UK, and if it does, it's like barely anything, like 1 or 2 people. But what we've seen from this virus so far, you can see the jump in cases. I'll put it on the screen. The jump in cases in the UK and in Europe in general is quite significant. And now Europe has more new cases. It's confirmed now, Europe has more new cases than Asia. So think about that. People were telling me that I should leave China when the cases were about the same as they are in Europe right now. So you can imagine how bad it is in Europe right now with the coronavirus. So I'm not sure what the death rate will be, but if you look at Italy as an example, it seems to be quite high. As it spreads throughout Europe, I'm learning more and more about the European health system and general hygiene and lack of, and just the general attitude towards these kinds of viruses. I've seen so many interviews on the TV and spoken to my friends, like I said, and it just seems like no one's really that bothered. Obviously there are people snatching up the toilet paper and apparently taking all the chicken. That's what I've heard. Someone in my family's found out when they went to the supermarket there was no chicken, which is okay, but a minority of people. The majority of people are just generally not bothered. If you want to protect yourself, you can do like what this girl is doing in the picture. I'm not sure if that's the best way, but if you're running out of supplies, then I guess a bottle over your head with a face mask on is probably about as good as a respirator. And just finally, I'm going to put the 4 stages of the UK battle plan on the screen right now, and you can have a look with me. So the first stage is detect and isolate, trace people who have come into contact, and screen travellers from high-risk areas, to and from high-risk areas, which is a waste of time because, as we know, high-risk areas now is just the world, anywhere. Stage 2 is slow the spread of the virus and push it away from the winter season. What the hell does that mean? How do you slow the spread of the virus? I don't understand. Encourage closures of schools and more working from home. Yeah, only some people have that option. Launch public awareness campaign for personal hygiene. That should have been in stage 1, to be honest, because, you know, ban large-scale gatherings such as sporting events. That's fair enough, yeah. Stage 3, research. That should be done at stage 1, to be honest. Any kind of threat to the population should have some research, so yeah. Constant monitoring and research of the virus with the aim to reduce its impact. Okay. Look for new diagnostic tests, drugs to treat patients, and preventative vaccines. Yeah, that's good. Prepare for multiple waves of the virus, okay. And stage 4, the last stage, mitigate. Cancel all but essential care and support at hospitals. That is a killer. Literally. Army on the street and police concentrating on serious crime. Okay. Hospital staff, leavers and retirees could be called back to duty. Fine. I'm looking at this right now in the UK as pretty much like Wuhan was in early January, so the worst is yet to come. The next 2 to 3 months, it's not going to be good. And apparently, according to this crazy, scary headline, there's going to be about 6 months worth of disruption from the coronavirus. We'll see. I don't know what they mean by peak. Everyone's using this word peak as if like some kind of virus with no cure just disappears. I guess SARS kind of did, but yeah, we'll see what happens with the coronavirus. It doesn't seem to be scared of hot or cold if you look at the countries that are affected. Although there is a line going across, it's like the Tropic of Cancer, I think it is. A lot of the cases seem to be focused around there, although I'm just not sure if that just happens to be where rich countries are and countries that are doing the tests just happen to sit around that line. I'm not sure. We'll see. Alright, that's all from me. If you've enjoyed the video and want to see more, give me a thumbs up, subscribe to the channel, leave me a comment down below. Let's talk about this stuff. Have anything you want to add to the video, add it in the comments down below. Let's talk about this, and I will see you tomorrow. Bye.